Hello, everyone. We will start now. Let's start the recording. Hello, everyone. Today we will finish our free revision sets with the 5th revision session. Okay, as usual, we will discuss about 20 questions, some of them from previous exams, and some of them as a general information. You should know them. And as usual, I will make all of you mute. And if you have any question, please open your mic and ask about it. Okay. At the end, I will give you some announcement about the exam and about the full revision in our website and the mock test that provided from our website. Okay, so let's start. The first question: which of the following is the least cardiotoxic NSAIDs? Which of the following is the least cardiotoxic NSAIDs? Here we have 4 choices: the naproxen, meloxicam, celecoxib, diclofenac. The first drug that you can exclude is celecoxib or the coxib family, because it will lead to some cardiotoxicity. Okay. Also, it may have some black box warning on their boxes. Okay. So the least one here, it is naproxen, followed by meloxicam. So if naproxen is not present, meloxicam will be the choice. The next question: what happens when you take a parenteral preparation that not isotonic? So it may be hyper or hypotonic. So let us see what will be the action of hypertonic infusion and the action of hypotonic, and see which is the right answer here. Hypertonic solution doing what? Generally, when we have 2 solutions separated by semi-permeable membrane, what is the direction of the fluids in between the 2 solutions? One of them is highly concentrated, right? The right solution, and one is low concentration, like the left solution. So what is the direction of the flow, from right to left or from left to right?
Left to right.
Yes, from left to right, from lower concentration to higher concentration. Okay, so suppose we have a hypertonic, it have a higher concentration than plasma, so it will make a section of the fluids from the tissues and from the cells surrounding it. So it will cause a section of fluids from RBCs, leading to shrinkage of RBCs. Shrinkage of RBCs. For hypotonic, here having a lower concentration, therefore the fluids going from it to the surrounding tissues or to the RBCs. So it will lead to swelling of RBCs. Then after swelling, it will have a rupture. And hemolysis will happen. Okay, so that the first choice here is the right one. Okay. My question here, can we inject hypertonic solution to the patient or not? Yes or no?
Yes. If IV bolus, yes.
If IV bolus or infusion also?
Infusion also, okay.
Yes, infusion. Why? Infusion can be injected to certain types of conditions. When you have intracranial pressure or fluids in the brain, for example, we need to make a section for these fluids from the brain cavities. So the hypertonic solution helps to do that by going through the vessels and make a section of the fluids from the intracranial cavities. Also, when we have intraocular pressure, we can inject in certain situations, but we cannot inject hypotonic solution at all as infusion. But as a bolus, we can, because the bolus maximum volume of the injection is 10 milliliter, which will not affect the huge amount or huge volume of the blood. Okay, the infusion should not be hypotonic. It should be isotonic firstly. And in some specific situations, we can inject hypertonic. Okay?
Doctor, here's my question.
Yes, please.
Your question states what happens when you take a parental preparation that is not isotonic. So it is not here hyper or hypotonic mentioned. So how can we can conclude that it will call to hemolysis?
Let us see the other choices here. He didn't mention is it hypo or hyper. So that I put the action that happened when hypertonic solution injected and hypotonic solution is injected. Okay, and see which is compatible with the right answer. Okay, this is why I choose this one. Okay, is it clear?
Okay, so you want to say that we have to just identify on ourselves what are the possible options?
Yes, you should see the possibilities. He didn't mention even it is hyper or hypotonic. So we need to know the possibilities for both of them and then match the possibilities with the right answer in the choices. If you see the other choices, they will not compatible with any of those conditions except the first one, which is the right answer here.
Sorry, doctor.
Yes, please.
I'd just like to ask, when you said that it goes from a low concentration to a high concentration, in what capacity is that? Because normally as passive diffusion, it's from a high to a low.
No, here we are talking about the osmolarity. Two solutions are separated by semi-permeable membrane. Okay. Normally, the two solutions try to make the concentration similar between both. Why? To decrease the osmotic pressure that happened on this membrane. Here we have a high osmotic pressure on this membrane.
Okay,
a high.
thank you.
So that the fluids here try to dilute the other side in order to make it less concentrated and to balance in between the two concentrations on the right and the left. Okay.
All right. Thank you so much.
Okay. Let us see this one. The following drug described as diuretic, antidiabetic, laxative, or muscle relaxant. Here we have a structure, and we want to know what is this structure or to which group this structure related to in order to know the therapeutic use of it. Yes, it is sulfonylurea. It is easily to know. How? Firstly, as usual, we should know the specific nucleus or the specific functional group that present in the structure in order to make the connection between it and its drug group. the very important group here appearing, this one. What is this one? Here we have two groups. S, 2 double bond O, N, we called it sulfonamide. Okay, sulfonamide is present in many drug groups. This one, what we called it, C double bond O, and 2 nitrogen atoms connected to the C double bond O. This is the structure of urea. So directly, it is sulfonyl urea. Sulfonyl urea is the anti-diabetic agents or oral hypoglycemic agents. This is the glibenclamide structure. It's not important to know which drug specifically is, but from the main nucleus of the structure, we understand that this structure related to sulfonyl urea as an anti-diabetic agent. Okay. Also, the question may coming like the following: what is the main side effect of this structure? Maybe coming like this. So how can we solve? By the same way, knowing the drug group, then after knowing the drug group, you can easily know the main side effect of it. Here, as you know, it is sulfonyl urea. So the main side effect of it is hypoglycemia. Yes. Okay. This is how can we solve most of the structure questions. Werner-Korsakoff syndrome. This syndrome resulted from which type of deficiencies? Is it riboflavin, thiamine, folic acid, or ascorbic acid? It is, yes, it is a syndrome happened due to the deficiency of vitamin B1. Vitamin B1, which means that it is thiamine. Okay. While riboflavin is vitamin B2. Folic acid is vitamin B9. Ascorbic acid is vitamin C. Okay. Sorry, I'll make all of you mute for interruption to avoid interruption. So, and if you have a question, please. Yes, please open the mic when you have a question. The beriberi, also another syndrome, happened due to the deficiency of vitamin B1, thiamine. Okay, it is due to deficiency of vitamin B1 for mostly alcoholic patients. Hemolytic anemia may be resulted from the treatment with which one? Doxycycline, clonidine, methyl-dopa, amlodipine. Yes, it is methyl-dopa. Let us take a look about hemolytic anemia. What is this condition? It is a hemolysis of the blood. Happened due to two reasons or two main causes of this hemolytic anemia. Either genetic effect or due to deficiency of glucose 6-phosphate dehydrogenase enzyme. This enzyme is important to prevent hemolysis of the blood. Okay.
Sure.
And the deficiency of it may lead to hemolysis of the blood. Some drugs will lead to deficiency of this enzyme, like what? Like methyl-dopa, like levodopa, like the cephalosporins may lead to these deficiencies. Okay, so it may lead to hemolytic anemia due to the deficiency that happened due to this enzyme. Also, the relation between this and COMPS test. What is the COMPS test? COMPS test is the test, laboratory test, done. Yes, done for the patient to differentiate between both to differentiate what is the main reason. So it is done for the patient having already hemolytic anemia. Okay? It's not done for the patient to know is it hemolytic anemia or not. The patient here already diagnosed as hemolytic anemia patient. But here we want to know the cause, the reason of that. So this test, KAPS test, done to differentiate between both. The positive result means it is a deficiency of glucose 6-phosphate dehydrogenase enzyme. Some drugs will give a positive result with this test. We called it false positive result, like methyl dopa, like levodopa. Okay, so the patients who are going to do this test and taking methyl dopa as a medication, the false result will appear with his results. Let's see the next one. Again, there is a structure, but the structure here is for, it's appeared to be fatty acid, because here we have a carboxylic group and long chain, either fatty acid or one of the prostaglandins. Both are of the similar structure or related structures. So here it is a fatty acid. Fatty acids can be or can take a numbering from the carboxylic group, which give the IUPAC name of the acid, or from the other side, from this, to give the omega system. The omega system means the first double bond located at which carbon? Carbon number 3, number 6, number 9. So for this compound or this structure, it is omega, here 1, 2, and 3. So it is considered as an omega 3. Okay, it is omega 3. So is it linolenic acid or linoleic acid or docosahexanoic or icosapentanoic acid? Okay, the answer here, it is linolenic acid. Let us see different omega system. Linolenic acid, it is omega 3, 3 double bonds compound. Linoleic acid, omega 6, the first double bond starting from the carbon number 6, in between 6 and 7 here. Omega 3 contains 2 or 3 double bonds as cis, are polyunsaturated fats. Let us see this calculation problem. The isotonic NaCl, 0.9%, contains, you can calculate it or you can reserve it in your mind. Mostly, the NaCl is 150 millimoles of sodium. How it comes? How can we know that? This is the simple way for calculating why it is 150 millimoles. 0.9% means 0.9 grams present in 100 milliliter. So the 1 liter contain how many grams? It is 9 grams, which is corresponding to 9,000 milligrams. Now we have the rule saying that millimoles equal weight by milligram over the molecular weight. Just divide the weight over the molecular weight to get the number of millimoles per liter. It is 150, approximately 150 millimoles per liter.
Excuse me, doctor.
Yes.
There was also a similar question I have done. That here is question is that they're asking for millimole per liter of sodium ion. So why are not we dividing by 23 instead of 58.5? Is the molecular weight of the whole compound NaCl.
He gives you the molecular weight of the whole compound here, not for sodium alone. So you should use the molecular weight given. Okay. I know your question asking about what? He asked about sodium specially. Sodium specially, so you should know the weight of sodium specially, not the whole compound. You are right in this point. But here, he gives you the molecular weight of the total compound and the choices not containing 340 millimole per liter of sodium alone. Okay, did you get my point?
Yes, right. Thank you.
Okay. Another calculation problem. How many milliequivalents? We need to calculate the number of milliequivalents of magnesium are present in 50 milliliter of 20% magnesium sulfate solution. The first step, generally, is translation of the percentage. This percentage meaning what? 20 grams present in 100 ml. Okay. But we need to calculate the volume or the weight present or the milliequivalents present in 50 milliliter. So 50 milliliter containing how many grams? 10 grams. Okay. Or it should be by milligrams because we are calculating the milliequivalents. So it will be 10,000 milligrams. Here, milliequivalents equal weight in milligrams over molecular weight over the small n. Don't forget the small n because we are talking about milliequivalents. But if we are talking about millimoles, so it's not present, the small n not present in this case. Therefore, we should divide the 10,000 over the molecular weight that present, 246. Okay, you will get the answer, which will be 81.3. You have a stock solution that contains 10 milligram of active ingredient. Okay, per 5 milliliters. So every 10 milligrams present in 5 ml. The physician orders a dose of 4 milligrams of the drug. How many milliliter of the stock solution will have to be administered? It's a very easy. 4
sorry, Doc,
milligrams.
can we just go back to number 8?
I'm sorry, again. Question again.
I'm sorry, can we just go back to number 8? I didn't quite understand.
Question number 8. Which part you stuck in? Or the whole question?
Yeah, I think the whole question.
The whole question. Yeah.
Yeah.
Okay. Here he needs what? He needs the number of milliequivalents of magnesium. Okay. He needs the whole milliequivalents or the total milliequivalents present in what? Present in 50 milliliters. Okay. So we have a tube or bottle containing 50 milliliter of magnesium sulfate. Okay. Its concentration is 20%. You need to know how many milliequivalents. How can we do that? In order to calculate the milliequivalents, we need to know the weight. Milliequivalents of what? Milliequivalents related to the weight. How can we get the weight? Here we need to know the weight of magnesium sulfate that present in this volume by this concentration. This concentration is saying that 20 grams in 100 milliliter. 20% means 20 grams in 100 milliliter. So the 50 milliliter that we have containing how many grams? The half. It will be 10. Okay. But we should convert it into milligrams because here the milliequivalents need the weight by milligrams, not by grams. So we use the 10,000 milligrams. Just divide the 10,000 milligrams over 246 46 over the small n, which is 2, because magnesium here having valency of 2. Is it clear now, or still you have a confusion about it? Okay, so again, question number 9 here, it's a very easy and direct question. Here we have 10 milligrams of the drug present in 5 milliliter. The 4 milligrams present in how many milliliters? Just crisscross. It will be 2 ml. Okay, a very easy and direct question. Some questions on the exam will be like this. Okay, don't worry about the calculation at all. Many antipsychotic drugs have strong antiemetic effect. This is due to what? What is the effect that leads to antiemetic effect of the antipsychotics? It is the dopamine receptor. As you know, antipsychotics will lead to decreasing in dopamine by blockage dopamine receptors. So this effect also gives some antiemetic effect. All the following are mixed agonists. I'm sorry, let's go back to the previous because some of you answered the serotonin receptor. Which serotonin receptor leads to emesis? When serotonin binds to 5-HT3 as an agonist, or if a drug as an agonist to this receptor, emesis will happen. But if you block this receptor, antiemetic effect will happen. This effect happened with the group of drug ondansetron, palonsetron, and downsetron also. Okay. While the antipsychotics, especially the type 1 or the first generation or the typical antipsychotics, will affect mostly the dopamine receptor and not affecting serotonin, with a very little effect on serotonin. So the main effect on dopamine have a little effect on serotonin, but this is not the effect that leading to antiemetic effects. Okay. All the following are mixed agonist antagonist opioid except naloxone, nalbuphine, buterphanol, pentazocine. All of them are mixed except naloxone. It is blocker or antagonist. So it is used as an antidote. Let us see this calculation, this type of calculations, pharmacokinetic calculations. Approximately 50% cloxacillin excreted unchanged in the urine. What is the meaning of this expression? Excreted unchanged in the urine. What does this reflect? Please pay your attention with me in this point. When he mentions that the drug is excreted unchanged in the urine, this means that the kidney does not, yes, the kidney does not affect the excretion of the drug. What does this mean also? Whatever the kidney status, this percent not affected by the kidney. What else? Even the kidney not working at all, have 0% working, this amount will be excreted from the body. Okay? So the 50% of cloxacillin excreted unchanged in the urine, this means that when inject or administered 100 milligrams of cloxacillin, 50 milligrams of them excreted, whatever the status of the urine. Is it 100% function or 0% function? 50 milligrams will be excreted. Okay? If normal dose schedule is 120 milligrams, 25 milligrams every 6 hours. So the dose here is 1 to 5 milligrams every 6 hours. A patient with renal function 20%. So what is the dose in this case? This 125 milligrams can be divided into 2 parts. 50% of it affected by the kidney, which is how many? 62.5. Okay. And another 62.5 will not affected by the kidney. This one excreted whatever the kidney is 100% or 0%. But this amount will be affected by the status of the kidney. The status of the kidney here affected or becomes 20%. What does this means? 20% means that if the drug administered as 100 milligrams, this 100 milligrams should be decreased to 20 milligrams. Because the new function of the kidney is 20% of its original. So we should decrease the dose by 80%. Or you should multiply this 62%, 62.5 by the 20% to know how many milligrams should be injected. Okay, let's do it. 62.5 multiplied by 20% will be 12.5. So this amount, the 62.5, should be reduced to be 12.5, right? And still we have 62 not affected by the kidney, so it is added to the dose. So you should add this 12.5 to 62.5 to be 75 milligram every 6 hours. Is it clear? Okay.
Yes, sir.
Okay, thank you. Let us see the next one. Normal rectal temperature is usually, yes.
Why we don't use the rule of D impairment equal D normal في creatinine clearance impairment على creatinine clearance normal?
We use it, but in not in direct way. Okay, we use it already. Use it adjustment. Those adjustment here, those adjustment factor. We use it and apply it on this amount, the 62. The dose adjustment factor here is the 20% or 0.2. Okay. Yes. Any other question?
دكتور سوري هو هنا في is there any equation or formula for this one or we have to go through drawing or dissecting it?
The best way is going through the logic thinking about it. Okay. Here we have a part of the drug excreted without the effect of the kidney. So this part excreted whatever the kidney is 100% or the kidney is 0%. So this will not affected by the kidney status. Okay. This means that when the kidney is 100%, it will be excreted. If the kidney is 0%, also it will be excreted. So we should exclude it from the dose adjustment and add it to the part that should be adjusted. Okay. Here, the part that should be adjusted is the half of it, which is 62.5. How can we adjust it? According to the function of the kidney. The function of the kidney here decreased by 80%. and the new function is 20%. So you need to give a 20% of the dose that affected. Okay, which is 12.5. Then add it to the part of the dose that should not be, or that will not be affected, which is 62.5. Therefore, the final dose will be 75 milligram per 6 hours.
Sir, can you please discuss any other type of question which can come in exam related to this unchanged form?
No other types. No other types. If this type of question comes, it will come by this way.
Excuse me, sir. Please, I have a question.
Mm-hmm.
Why did you not go ahead to find the percentage from the total quantity of clozaceline, which is 125 milligram? Why don't we do 20% of 125 milligram as against doing 20% of 62.5?
If he didn't mention the first statement, you should do that. If he didn't mention that a 50% of the cloxacillin excreted unchanged, you should do that. You should multiply 125 by 20% to know the new dose. Okay, but here, as I mentioned, that a 50% of the drug does not affected by the kidney. This excreted unchanged in urine means it does not affected by the kidney. So when the kidney is 100% active, this percent will excrete it. And when the kidney is 0%, if there is no kidney, also this percent will be excreted. So we should exclude it from the calculation. Why we need to adjust it? It will not affect it. Okay, so we don't need to adjust it. We need to adjust the amount that affected by the kidney.
So if the first part is not there, the 50%, we would do 125 times 20% as dose adjustment.
Yes.
Okay. All right.
Yes.
Yep. Good. Thank you.
Okay. Let us do it with another percentage. Here, he put the 50% to make it easier for you. Let us make it more difficult. How? Let us make this 50% as 20%. Sorry. Let us make this as 20%. So, what you will do? The first step is the excluding of the 20%, which excreted unchanged. So you should firstly multiply 125 milligrams by 20%. It will be 25
mg.
mg. So the 25 mg will be excreted unchanged. This will be put it in the side and added to the affected part. The remaining will be 100. 100 mg will be affected by the kidney. The kidney now, its function is 20% of the normal function. So the drug that given by 100 milligrams should be by 20 milligrams. Okay? Then add this to the 25. Now the new dose will be 45 milligrams.
Thank you, sir.
Is it clear now for all of you?
Yes, sir.
Yep. Thank you.
The normal rectal temperature is usually measured in the evening or about the same as normal oral temperature, or about 1 degree lower than oral, or 1 degree higher than oral. It is 1 degree higher than oral, not lower. The answer number D. which decreases the tension between solid and liquid. It's an important question also. Here's the tension between solid and liquid. Which type of agents will decrease this? Is it solubilizing agent or wetting agent or hydrophilic or emulsifying agent? Here, the tension between solid and liquid is called interfacial tension. It is the force per unit length that acts along the interface between the solid and liquid. It depends on cohesive forces within each phase and the adhesive forces between the phases. Okay? The wetting agent is the substance that reduces this tension. When we are talking about solid and liquid, it's called wetting agent. While when we are talking about liquid and liquid, it's called either emulsifying or surfactants. Okay? So this is the expression for each emulsifying agent or surfactant. This one is between liquid and liquid. While when we are talking about solid and liquid, it's called wetting agent.
So this is used in suspension?
I'm sorry?
Wetting agent is a term for suspensions?
The force tension or the tension between solid and liquid. This is particle of solid and this is the liquid. This tension.
So wetting agents are used in suspension?
Yes.
Yes.
Wetting agent for suspension. Yes. Yes. For suspension. Find the ratio in or the ratio of ionized and unionized drug species at pH 7 and pKa 5. How can we do that? By using of the formula pH equal pKa plus log the salt over the acid, or ionized over unionized concentration. Okay? Here we have the pH of 7. The pKa is 5 plus log ionized over unionized. When you transfer the 5 to the other side, it will be -5. So 7 minus 5, it will be 2. Therefore, the log ionized over unionized equal +2 or +2. This log value, if it is +2, this means that the ionized over unionized equal 100. This ratio means that the ionized more than unionized by 100 times. So this is the ratio. Okay?
Yes.
The last part of small intestine is called fundus, ileum, jejunum. For sure it is ileum. While the first part is called duodenum. This is the first part. Question related to the stereochemistry. We have two isomers here. The following structure non-superimposable on its mirror image show R and S configuration. This optical isomerism is called what? Let's see the characters, the 4 characters here. Here we have mirror image. We have not superimposed. Plus we have one chiral center. And both are optically active. The 4 characters related to the enantiomers. So that this structure is, or those isomers are enantiomers. The following.
Can you please explain a bit about option B and 3? What will be the optical isomers and geometric isomers?
Optical isomers and geometrical isomer. Optical isomer, both are optical isomers. This is also right, but specifically they are enantiomers. Okay, one of them is D, optical isomer, one of them is D, and the other is L. Yes, they are. But which type of isomerism specifically? It is enantiomer. The geometrical isomerism here, we are talking about double bond C, double bond C. And we have cis and trans. Okay, here we don't have C double bond C. So it is not geometrical isomerism. For diastereomers, it should be at least
2 chiral.
2 chiral centers. At least 2 chiral centers. Here only we have 1. So directly you can exclude the diastereomers. The following is a prodrug: ethinyl estradiol, hydrocortisone, spironolactone, testosterone. Sorry, most of you falling down in this question. You give the answer as testosterone. No, it's wrong. It's not a testosterone. Even it should be it will be converted into
Estrogen.
not estrogen. Here, testosterone will be metabolized in the body directly when you administer it as an oral. Okay, into dihydrotestosterone. But testosterone is still effective. While ethinyl estradiol is the prodrug. Because ethinyl estradiol itself is not effective. It should be converted to estradiol to give the effect. Okay, so the A is the right answer. Low molecular weight compound that acts as immunogen after chemically complexing to a large molecule. We call that, yes, hapten. Hapten by itself is not immunogen or not leading to immunological effect, but it should bind to a large molecule like protein to give that immunological response or to be as an antigen. Okay, this is the meaning of hapten. The last question today is a calculation question. Let us see it. You are to prepare 750 milligrams of medication in 75 milliliter for infusion over 30 minutes. So this 750 milligrams present in 75 ml. This 75 ml injected over 30 minutes. The dropper of the infusion set applied with 10 drops set. What is the meaning of 10 drops set? It means that every 1 milliliter of solution equivalent to 10 drops, or every 10 drops equal 1 milliliter. Okay, this is the adjustment of the infusion set of this dropper. How many drops per milliliter will be injected? Here we need to calculate number of drops per minute. Number of drops per minute. Okay. To do that, we need to know number of milliliter per minute. Okay. Here, the 75 milliliter injected over 30 minutes. Right? For 1 minute, how many milliliter injected? Divide 75 over 30. It would be 2.5 milliliter. So every 1 minute you inject 2.5 milliliter. Okay. Every 1 milliliter corresponding to 10 drops. So the 2.5 milliliter, how many drops? Here. Multiply 2.5 by 10 over 1, it will be 25 drops per minute. Okay, is it clear?
Yes, sir.
This was the last question today.
Sir,
Okay.
can you repeat the pH one?
Which one?
The pH and the
pH.
ionized and unionized form.
Okay, the question related to the pH and the ratio.
Yes, sir.
Yes, this one.
Sir, how we say it's 100%?
Here, the log value equal
Log
plus 2.
inverse 2.
Okay. When the log value equal plus 2, this means that the ratio is ionized over unionized equal 100. Okay. Or 100 over 1. This means that this amount is 100. If this amount is 100, this amount will be 1. This is the ratio. Or by other way, 100 to 1.
We can also calculate by log inverse 2. It will be equal to 100.
No. Log value equal plus 2, it's not equal to 100.
Yes, sir. That's why I'm asking.
It is equal 100, not 200.
Log inverse 2.
Log inverse 2, it will be, or log minus 2, it will be 0.1. If log value equal minus 2, it will be the value itself equal 0.01 or 1 over 100. In this case, the unionized higher than the ionized one. Okay. Yes, when you use the calculator here, you should use the anti-log. When you calculate it in the calculator or by using of calculator, you should do that. You should use shift log 2.
Yes, log inverse like shift log
Yes.
2. It will give 100.
Yes, it will give 100. Okay. I just put 100 because I know that the plus 2 means the number of zeros. Plus 2 means number of zeros. Here we have 2 means we have 2 zeros. Plus, if it is plus 3, it means 1,000. If plus 4, it means 10,000, and so on. Okay, this is the meaning of log, number of zeros in the number.
Thank you, sir.
Okay. I'll open the discussion, but firstly, let us go to some announcement points related to the exam. It's important to know it. Okay, for all of you who are going to the exam. As you know, it is computerized one. Okay, you will have 2 papers, each one having 100 questions, and you should solve them in 120 minutes or 2 hours each paper. Okay, in your exam, when you see the questions, for example, question number 1, question number 2, question number 3, and so on, you will not go to the next one unless you solve the question. So, for example, this is the question number 1, and here we have 4 choices. And here you will find the function next, or for question 2, you'll find the function previous. Okay, you cannot press on next unless you choose any of the answers. You should choose any of the answers to go to the next question. Okay, what will happen if you don't know the answer or you're confused about the question and you need to revise it later on? You should choose any of the answers. For example, we choose B. Then press, you will find a flag here. This flag will memorize you which question you should go back to it. Okay, so it is important to do that if you don't know the answer. Press the flag. Then after you finish the exam, after the question number 100, before you click on the submit, if you click on the submit, you cannot go back to the exam at all. Okay, it will submit it and correct it as you submitted. But before submit, you will find a table at the end of the exam. This table giving you the question number and your response. Okay, and if it is flagged or not. The question and your response. It will be like this. Okay, so here we have the question number 1 and question number 4 having a flag. You can press on it to go back directly to question number 1. Okay, so you can revise it and choose the right answer or correct your answer if you want to change. Okay, after changing, press again to the flag to remove it in order to remove it from this list. Then go back to this list again to see the flagged questions, to revise it. Okay, those are some important announcements about the exam itself. In between the two papers, there is 1 hour optional rest. It is optional. You can take it or not. My advice is to taking it the 1 hour, because paper 2 will be more difficult. It needs more concentration. So you need to be relaxed in between the two papers. Okay, you need to be relaxed. Don't think about anything to make your mind fresh for the next paper. Okay, then go to the paper number 2, the same sequence of the questions and the flags. So you should take care about these points. Another announcement about the full course. Still, you have the opportunity to attend the full course till the exam is present. All videos of it is present, and you can listen to it at any time you want. So you can go to the website and to this link to see the full course, and you can join it. Okay, let me show you how. Here is the link in the website, uptech.com. In the courses, you will choose the KAPS exam preparation courses. Then from this list, you can choose the comprehensive revision. Okay, either add to cart directly or view more. Okay, when you join, you will find the curriculum. I'll show you now. Yes, the flagged questions can be corrected. Yes. Here, when you open, when you add the cart, the course will be added to your account. Then you can go to the curriculum and see here those closed lectures will be opened. Okay, and the mock test included in this revision, in this full revision. This is the mock test, paper 1 and paper 2. No one told me that there is no screen, only stable screen. Okay, just 1 second to change the screen for you. Yes. Sorry for that. So let me repeat again fastly. This is the website, the newptech.com. Here, the courses. You can choose the KAPS exam preparation course. Okay. Okay. And then go to this list and choose the comprehensive revision. Either add to cart directly or view more if you want. If you add to cart, you will join the course. This is the view more. Here, when you join the course, this page will open with you and press on the curriculum. For the curriculum, it will show you the list of lectures, the set of free revision program, and the other complete revision for complete lectures. Okay. This look will be open. And the mock test included here. This is the mock test. Also, you can go to the mock test directly if you want to join the mock test only. Also from the courses here. Then browse now for the KAPS exam preparation courses, or KAPS exam courses, and this list, the coming list, this list, you'll find the mock test separately. Okay, so you can buy it. Okay, we'll give you the test here from curriculum. Also, you have 2 papers, paper 1 and paper 2. This look will be open. When you press on paper 1, then start button, you will start the test. Okay, the payment in US dollar. Okay, you will start the test when you start button. Okay, it will give you the questions like the real exam, 100 questions per each paper, as you see, for 120 minutes. Okay, after you finish, you will find the result, your response, and you can review your response. You see the test 3 times. Okay, you can repeat this test 3 times. This is everything about, yes, I will open the discussion now. Yes, okay, let's open the discussion now. Just, okay. Yes, please.
So is the time 120 minutes as per the mock test in the exam? Will it be 120 minutes
per paper?
Okay.
Per paper. Each paper 2 hours or 120 minutes.
All right. Okay.
And the schedule, the timer in the exam will go down. So it will start from 120, then 119, 118, and so on. You will see the time in the top of the paper.
Sir, once we have solved the first flagged question, how we will go to the next flagged question? This list will constantly appear on the screen?
Yes, it is constantly appear. So you can press on it to go to the list of questions. And help you to go to any question, either flagged or not. The flagged questions can be corrected. Any question can be corrected.
Okay.
If you still not submit any paper, any question can be corrected, either flagged or not.
Once you told that, what is that situation in which all questions will be flagged? You told that if you have double-clicked something, what was that?
If you do that, you will lose the function of flag. How? Suppose you flagged all of the question. Finally, you'll find the list will be like this. So which question you will go back to it?
Okay.
It's not of not of sense here, or it's not logic here. Just the flag, the question that you need to go back to it. And if you're sure about the question and your response, don't flag it.
Yeah, right.
Sir, actually, I attended my mock test yesterday, and
Mhm.
I am concerning about 2 to 3 questions I already sent to your message. So
Okay, we
can
can
you?
discuss.
Yeah.
We can discuss it separately. Okay.
Okay. Thank you, sir.
Do you have any other question?
Doctor, can I ask about the mock
Yes.
test? The questions are from the revision or new questions or?
Some of them from the revision, some of them having the same ideas but different statement, and some of them are new. It's same like the real exam with the same situation. You'll find in the real exam some of the questions typically like what we discussed, and you'll find some questions having the same ideas, the same concepts. So you should think about them. And you'll find some new, but don't worry, because the new questions, the percentage of new questions will not affect your response if you are studied well. Okay? Just about 20 to 30% of the questions are new, but not all of them are completely new. The new questions means questions with new statements, but maybe with the same ideas that we discussed. Okay, so that we discussed the ideas, not the question itself. Also, the completely new questions not increase or not be more than 5 to 10% of the exam, which will not affect at all your passing record. You just need a 50%.
Yep. Thank you.
This means that trust yourself, go to the exam without any confusion or irritable something or anything. Trust yourself, trust your study. You can do it very easily, inshallah. Any other question? Okay. Finally, I'd like to thank you, all of you. Thank you very much for your attendance and cooperating this revision. I hope it was useful for all of you. I hope it will help you for passing the exam. Still, we are together at our groups. If you have any help, any question, please send it to me directly or in our groups. I'll try as much as I can to answer it. I apologize about the late reply in sometimes because I have a very huge pressure on the messages, so I cannot reply all of them directly. So, but finally I will reply. Okay. Thank you so much, and good luck for all of you in your exam, and see you after your pass. We will celebrate together. Goodbye.
Thank you, sir.